All right, everybody. Thank you so much for joining us today. My name is Kenna Stanley. I am a Senior Research Associate with the National Safety Council's Work to Zero initiative. We're really excited to be here for the second webinar in our ongoing webinar series with the American Industrial Hygiene Association. If you have been unable to join the webinar series, our first webinar was last Thursday. No worries whatsoever. That webinar was posted and is available it will be available on our YouTube channel along with today's webinar and the third webinar. So as a reminder, our webinar series is really focused on heat stress mitigation and the emerging use of wearable technologies for things like measuring worker health, keeping track of worker health and location, and providing early alerts to workers and supervisors if they are approaching dangerous levels of heat stress. That being said, this webinar will focus on common barriers to wearable technology. So we have some fantastic speakers today who will speak to some of the legal considerations, compliance, employee buy-in, workplace culture, and all of those important elements that go into having a successful technology program and a successful wearable program. Our third webinar will be in a couple of weeks on Monday, July 29th, where we will delve into some of those employer use cases for wearables. Again, all of this great information will be posted on our YouTube channel at National Safety Council. So if you're interested, you don't need to take notes or write this down. We will make these available to you. That being said, Neil, Jay, if you could both go ahead and introduce yourselves. Neil, I will start with you.
Sure. Thank you so much. My name is Neil Felcher. I'm the Director for Environmental Health and Safety here at New York City Department of Environmental Protection, the Bureau of Engineering, Design, and Construction. And I'm also an adjunct professor at City University of New York.
Jay?
Yeah, good afternoon, everyone, or good morning to probably some of you. Jay Vitas, I'm the Director of Research at the National Safety Council. Prior to my time at National Safety Council, I was with NIOSH as the Chief of the Emerging Technologies Branch, and had served in the Air Force as a environmental engineer for full career before embarking on the post retirement. Glad to be with you.
Thank you, Jay, and thank you, Neil, for being here. So we kind of have it broken down in two main sections. Neil will be talking through some of the legal and privacy issues, and Jay will be talking through things like employee buy-in and workplace culture. And then if you have any questions throughout the duration of this webinar, please leave them in that Q&A box. We will do our best to get to those at the end. And if you would like to engage with any of your fellow attendees, the chat is also open. So if you have any questions, want to benchmark, want to chat about anything, that is also available to you. That being said, Neil, I will pass it over to you to kick us off. If you could go ahead and share your slides.
Sure. Okay. I should be sharing now.
Yep, looks good.
Okay, thank you. As I said, good afternoon, everyone. Definitely want to thank NSC and AIHA, in teaming up to provide these important webinars on heat exposures, heat stress, and certainly the use of wearables. I'm a big technology advocate, so really like to see that we're pushing the use of technology and wearables to actually improve safety. But my focus today is the legal and the privacy issues associated with wearables. And I'm sure you've seen some of this discussion perhaps in the news in the past of what people can actually see. But certainly, as we're seeing a federal push for the advocacy for wearables, it's really important for us to think about not just what they do, what they can do, but some of these bigger issues that could potentially impact you, namely what I consider to be the legal and privacy issues. As I mentioned, I already introduced myself. I also should have mentioned I'm an attorney in New York and New Jersey. And for anyone who wasn't aware, so for my primary role, we're a regulator, but we're also a very large water and wastewater utility, providing over 1.1 billion gallons of drinking water per day. And the capital construction program that I manage is in excess of $30 billion. We do lots of different types of work in lots of different exposures. So, we do deal with heat exposures all the time. So this is one of the many issues that we deal with on a daily basis for the types of work that we do. And there's certainly nothing like a talk from an attorney without a disclaimer. So it is important to recognize, of course, there's no attorney-client privilege in anything I talk about. If you ask questions that are specific, there is no protection for that. So please, if you're going to do it, make it very general or somewhat anonymous so we don't know who it is. I'm also not going to express any specific legal opinions. And certainly as a government employee, one of the most important things is that all opinions expressed herein are those of myself as the speaker. They do not necessarily represent the opinions of the DEP, New York City, our mayor, or anyone else. And really the intent of this talk is to provide the legal questions and the framework, I think, that's really important when you start thinking about implementing wearables as part of your EHS program. It's really what I consider to be risk management. Recognize the issues so you can properly manage that risk. And I'm hoping that I can provide that general information that lets you understand the risks and the issues. So that if you are looking at wearables, you're rolling them out, you can make intelligent decisions on what you want to get, what services you may want to provide, or maybe you don't want services, and what you're looking for and the types of issues that you could run into. And as in most cases, these issues won't be apparent all the time. They might be very minimalistic issues, but they can arise and you need to be prepared for that. And I think it's something you should be thinking about as you roll it out, not as it happens to you. So what do I envision in wearables? I look at this as a very broad viewpoint. I know we're only talking about heat exposures here, but I think wearables, especially in the EHS field, is a much larger field and it's continuing to grow by the day. And so I consider this to be all the types of various technologies out there that can be worn by a worker, and there has a potential to reduce the risk of injuries or reduce the risk of exposures. And as I said, technologies continue to advance. This concept is going to continue to advance. Every EHS convention I go to now, I go to tech conventions all the time. Every single time we see new devices with new capabilities that are continuously being released. So this is only going to grow. It's going to grow by the month, not even by the year. When I discuss wearables and their specific information, they really fit into two main categories. Those that are just localized information, what I call the individual, and those that connect to some sort of a larger ecosystem. They may use Bluetooth to connect to a phone, to get to internet. They may have their own Wi-Fi. They may have their own cellular. They may have their own satellite connection. There's a lot of these types of systems out there that have a lot of functionality. The more reduced information you have, the more localized it is, the much less likely we're going to run into some of the problems I'm talking about. So when we're talking about the individual type devices, I'm generally not even going to cover them here. They're typically only communicating with the user. They're letting the user know something. Nobody else knows it. And therefore, we're not really going to see much in the way of legal issues or privacy issues. That looks in many ways a lot like all the older technology that EHS has utilized for a long time, which monitored safety conditions in various environments. And also, when I discuss wearables, I think it's really important to remember that some of the benefits of this technology is how well it can document effectiveness of our control programs, how well it can document our compliance programs. This is really useful information for injury claims, for workers' compensation claims, for defending in litigation. So there's a real big benefit to this. there's a real big benefit, and there's also a real big benefit to do things like data collection and networking and all this information. It not only lets you more proactively manage it, but it has a really important aspect to helping you as a company defend what you do and how you do it, to show you have a good EHS program. So I think you're going to only see more of that. When I talk about the risks, I lump them into three main categories. First, privacy, issues around employee surveillance, and then certainly cybersecurity issues. And so starting off with privacy, one of the first things I think you need to think about with this is what I call data ownership and sharing. And the reason I bring this up is because many wearables do utilize an interconnected structure, which allows you to access that information and data anywhere you have an internet connection. You could be anywhere in the country or the world and see what's going on in your sites, have alerts. That's the good side of it. But it does require a service. Typically, you're paying for a service, or part of your purchase of the equipment included a service. And then the data connects through that service. I suspect, like most of you, even if you have some of these, you likely have never read the contracts. There were contract documents, there were terms of service. People never read them until there is a problem. Many of these contracts will have definitions for data ownership. They'll also have allowances for sharing of data. It is very common in these, while you may own your own data, you often are giving rights away for your data to be anonymized and utilized by the company. They can use it they can aggregate it with other data, that they can use it to show the effectiveness of their systems, the effectiveness of their hardware, their software, the nature of what they're providing to you, and they can market from that. So if that's important to you, you may want to address that as part of your contract, or you may not even want to utilize that company. So I think it's something you really need to think about, because potentially you are sharing your information. That information is available to other companies. Also think about their companies and those actors that they may have. They have lots of employees. Are they accessing your data? Could they have an ulterior motive? Are you worried if this data was accidentally shared, if someone else looked at it? Would you have a concern? If you have a concern, and you really need to think about that as part of that issue, because you really are sharing this information with another company. After data ownership and sharing, the next thing is biometric data laws. So a few states and jurisdictions have now started enacting legislation about biometrics and the use of biometrics. At the moment, this is a growing field of regulation, but at the moment, all these laws have been focused on biometric data that can be used as a means of identification. So primarily right now, it's focusing on things like fingerprints and facial scans. The concern is that in the very near future, whatever that very near looks like, this may run up against the types of data that we use as EHS professionals. As we stop relying on things like, fingerprints and facial scans, which can't be completely fake, but it's becoming easier. The fact is, are they going to start looking at more biometric data, which may run up against some of the things that we could be looking at? And as these systems get smarter, another issue I think we have to think about here is the use of AI. We're seeing wearable manufacturers implement AI into their systems now, trying to use AI as means of doing things like predictions, predicting health outcomes, predicting health issues, predicting states of health, and whether someone's getting sick, or whether they're having a problem, or what they should be doing. And some of the states have now started to regulate the use of AI. Though there's certainly a potential this may be impacted by the recent federal budget bill, which does put limits on states' ability to regulate. However, there are a number of states that have already regulated, and it does not appear that any of those former regulations might be overridden, at least not at this moment. So regardless, at this time, these AI laws are focusing on companies' use primarily in the hiring phase and the hiring processes. I think once again, we're gonna have to keep an eye on this because it may run up against the exact ways that AI may be implemented for purposes of wearables and the AI data and the services that we're getting from them. And this issue has also been addressed by the Equal Employment EEOC, in regards to the ADA compliance. So I think, right now, once again, they're primarily focused on whether this provides disparate treatment in regards to employment and hiring. I haven't been able to find a scenario yet where a wearable may run into this, but I don't think it's out of the question. If a wearable works for one gender, one race, and doesn't work as well, you're going to have to consider if this is a means of protection. And if this is your primary means of protection, are you now not covering certain people? Could you be looking at that you're providing disparate treatment, which could run afoul of the ADA? It's certainly feasible. Some of the technologies that have not been rolled out in the way of wearables would have this problem. So I think it's something to at least keep an eye on. If you're rolling something out that does not treat all your people the same way, it does not work well for certain people, you may have to consider what are your alternative means of protection, and is it less protective? And then moving on to the medical and health data laws. The biggest one, of course, that always comes up, I've done numerous talks on this, is HIPAA, Health Insurance Portability and Accountability Act. I get asked about this all the time. And I think what's really important to recognize here is, who does HIPAA actually apply to? It applies to healthcare providers, healthcare clearinghouses, and their business associates. And then what does it do? It requires them to protect what we call individually identifiable health information from what we commonly call protected health information, or PHI. And I think the real question here for you and your companies is the work you're doing involving a healthcare professional, or are you somehow a covered entity? And I think you have to think about that, especially with some of the information that wearables can give you. If a wearable is indicating a health issue and you are going to respond with healthcare services, you could actually find yourself falling under HIPAA. And so I think it's something, while I generally tell practicing EHS professionals, HIPAA almost entirely unlikely applies to you unless you actually work in the healthcare field. The fact is, with wearables and the information they provide, it is very possible that you could run afoul of this if you are going to respond with healthcare services based upon what wearables are telling you. And that is something to at least think about. I will say, on the other side, though, HIPAA isn't that restrictive. In the sense of, what does it do to you? If you're really under HIPAA, there's certainly going to be requirements in regards to how you maintain information, the protections you give it, how you maintain private records in both electronically and in the sense of paper. So it's not really that hard to comply with if you had to, but it is something you need to start thinking about, depending upon the type of wearables you're utilizing and depending upon what your response would be to that wearable. And so we talk about HIPAA in this country, and which is primarily about health insurance, but you also need to think about, if you have an international practice, you need to envision not just what the United States say, but what other countries say. And probably the most important of that is the European Union. They have really been leading the charge in regards to not necessarily health information, but personal data. And they've been primarily the driving force behind personal data regulations. A couple years ago, a lot of you may have seen, depending upon who you buy stuff from, you may have gotten lots of email notifications from companies that their policies are changing and data retention is changing, and you can now do this and you can ask for stuff to be deleted. That's all the EU. That was all driven by the EU and their general data protection regulation. When it came out, it really addressed personal data. If you have data of individuals located within the EU, this rule applies to you. You can be a US company, you can be a South African company, you can be, a company in Asia, you can be a company in South America. It doesn't matter. If you have the data of people who live there, and are residing there, you are covered by this. You need to comply with it for those purposes. In classic EU fashion, it sets out a lot of principles for what they need to achieve, but really it was about limiting how much data you collect, data minimization, only collecting what you need for what your purposes are, and the security of how you are protecting it. It also gave individuals the right to request that their information be erased. They can object to the use. They can restrict the use. They have to be able to get their data from you. You can't just simply say, oh, it's too difficult, or you need to give me a lot of money in order to get your data back. You have to be able to get it back in an easy manner. And this applies to everyone who either controls the data or processes the data. So if you're doing this, and as I said, if it's bigger than just your company in a single state, if you're multi-state, you need to look at those states. And then if you're international, you need to consider what other countries do apply. And I will say, by the way, this isn't a bad rule to actually think about, because it is basically on the leading edge of data protection for individuals. So that's really what I consider to be the privacy issues. Granted, all of these sort of touch on privacy. The secondary issue I talk about is employee surveillance. Something to think about, some of this types of sensors, of these wearables, they also collect location data. And then you really need to think about how are you surveilling and how are you monitoring employees? Because monitoring employees during the work shift looks like one thing, but if this thing still collects data during breaks, during off time, that starts looking a lot more like surveillance. And think about some of the data you're then collecting. You're potentially collecting data that can be very personal to people. It can be showing things that they shouldn't be doing. It could be showing them going somewhere they shouldn't have gone. You now have that data, which is going to go into my next issue, which is the cybersecurity issue. But think about what you're collecting and how you collect it. Is this a wearable they slap on at 8 a.m. and they take it off, or is it something bigger than that? Some companies have implemented the use of wearables, which are around the clock sort of monitors. NBA did that during COVID. But other companies have done that. Apple's currently under suit right now for this exact issue. They push their employees to use the Apple ecosystem and then to allow the company access to it. But that is not 8 to 5. It's not 8 to 12 and then 1 to 5. It's all the time. That data is always there. Are you able to access that? If you are you sharing that with other companies? This could have a lot of problems associated with it. And going back to the privacy issue, think about some of that geolocation data, which could put people at risk. Someone who's been involved in domestic violence, who has restraining orders, and you're now potentially collecting their data as to where they are and what times they're there. I mean, think about how if that was to become exposed to the kind of trouble that could cause, that you would then plan to be responsible for. And then, as I said, with the cybersecurity issue, do you have the issue of devices being hacked, or more likely what you're worried about is data breach? What kind of information are you collecting? Right back to what I said at the beginning, like, do you care about sharing this with some company? But beyond that, what about bad actors getting access to your data? Is location data important to you? Is all this data you collect, if it's hacked, are you going to care that it's out there? Does it show the location of your properties that you didn't want shared? Does it show what your workers are working? Does it show that they do work individually where they might be exposed to, being robbed or whatever it might be? These are things you may not want. You have to think about what's being collected. It isn't potentially just about the monitoring. It can be all the underlying data associated with it. It's really nice to have that when you're doing it. It's really not so nice to have when it's accidentally shared. So I think if you want to utilize this stuff, I think, Roy, just to sort of summarize these issues, I think you truly need to think about what are you collecting. And it's not just like, oh, I'm looking at this. It's what is all the other data that's collected with it. Think about why you're collecting that data and how you're going to use it. Is it really what you need? And is it more than what you need? And if you're purchasing a service, read the contract, make sure you understand the obligations, make sure their obligations about protection, what they're going to do if the data is breached, how they're going to export the data to you. How are they going to be able to give it to you so you could leave to go to another vendor? You know, who can they share your data? Can they present your data at next year's conference? And not necessarily without your name, but that your data in general. Think about where it's being stored. Are you okay with that? Who has access to it? How? And, you know, I think this really just, you know, think about what you're collecting and the potential impacts, you know, talk to counsel, think about what you're collecting and whether it's going to impact litigation, incident investigations, claims, anything like that. So I just think those are the things that you really want to focus on as you go through this. And as you think about the implementation, because as I said, I think as these things roll out, you're going to see more and more potential for data to be shared.
Excellent. Thank you so much, Neil. If you don't mind, I actually have a couple of questions here that are, I think, pretty specific to this section. So if you don't mind, if I just throw those out to you really quickly.
Sure.
Is it legal to require workers to wear monitors, or does it need to be voluntary?
Or does it need to be what?
Voluntary. So they need to have some sort of voluntary element or consent to it.
So as with most attorneys, the best answer is always, it depends. And the answer is, it does depend. If you have a union shop, this may have to be negotiated. But in general, if this is a mean of protection, I'm putting you in there, there needs to be a monitor. An employee can't say, oh no, I don't want to have a monitor, because that is the means of protection. Putting it someplace else or not protect them are not acceptable options. So you need to be able to protect them. So the answer is usually yes, but you do need to think about the union issue. If you have a union thing, it can be a more sensitive issue. But I will go back to, once again, I think a union's going to have a very tough time objecting to something that is solely there for the protection of their employees, and anything less is less protective. That's very tough for the union to argue.
Absolutely, absolutely. And if wearables are used or flag risky behavior, and we use this data for disciplinary actions or decisions, can we face wrongful termination claims?
It depends. A lot of times, you know, if you're going to try to do that, please make sure you have an actual program. Make sure people are well aware of the program. Make sure they're well aware that they're actually being monitored. But no, I mean, look, if you use, I mean, we do it with, I mean, it's not wearable. We do it with like your GPS of cars. We flag bad drivers. We then put them in training programs. If they continue to drive poorly, they can be terminated. So yes, you absolutely can do it. But once again, be very leery. Make sure that the wearables actually tracking what they're doing during work, and you're not tracking things off work. Oh, I'm tracking that you were drinking last night, therefore today you're going to run into problems with that. But yeah, typically you can, but make sure you have a very clear disciplinary policy, and make sure that, you know, people are trained on it, they're aware of it, they know it exists, so at least it's going to be much harder for them to fight.
Absolutely, absolutely. And I have one more clarifying question. So the info you shared on HIPAA and privacy, does that apply only to environmental data, or does it also apply to biometric data?
So when we're talking HIPAA, we're talking about, I mean, I'm not quite 100% sure I understand the question. HIPAA specifically applies to healthcare providers, clearinghouses, all their business associates, and like, so you need to be providing essentially a healthcare type service. If you're just monitoring, so if I just have like a temperature monitor to say, okay, based on the temperature, you know, I'm going to do 45 on, 15 off, and, you know, and then I'm going to make you drink when you're in your 15 minutes and things like that. You're not really providing a healthcare service. You're not really doing anything like that. But if I'm using things like a wearable that can determine, you know, my internal body temperature, and look, you know, and potentially look at my heart at functions, and I'm seeing that, you know, Joe's internal temperature is rising and it doesn't seem to be stopping, and he's now got an arrhythmia, and I now go in there to help Joe, I might have crossed that line into providing a healthcare service. I might have become a healthcare provider at that point. It's a very, like I said, that's it. But no, if you're just doing sort of environmental type monitoring for, like, you know, contaminants in the air, or temperature in the air, things like that, and then taking actions on that, no, that would not, because that's not a healthcare service.
Excellent.
I hope I answered that.
I think so. And if whoever left that question would like more clarification, please feel free to leave it in the Q&A. I see a couple more questions. We'll get to these at the end. At this point, Jay, I would like to turn it over to you to talk a little bit about worker buy-in and culture.
Awesome. Thanks, Kenna, and thanks, Neil. That was a presentation. Really set up for additional discussion. Hopefully you can see that. And I'm really excited about this topic area. You know, wearables in general, but specific to heat stress. When I think of my background as an industrial hygienist, you know, there's 32 million outdoor workers in the United States. Beyond that, there's workers who work indoors and have potential for heat stress. And it's just exciting to think about how you can individually look at risk through wearables. You know, those that might be sick or dehydrated, maybe work too hard or not acclimatized. These are all really challenging scenarios. So despite the fact that we're going to talk about barriers and we're going to talk about the need for worker buy-in and some of the challenges associated with that, I think it's really an exciting time to be a safety and health professional. And so keep that in mind as we go through and maybe have some sort of what you need to do, but recognize the why is really significant in terms of opportunity. And I wanted to share this slide from our Work to Zero program at the NSC that really talks about it's not just the technology. The technology is cool, or at least it is cool to me, and I think provides us great benefits, but it really needs to be thought of in the bigger picture of you know, how do we get to the outcomes that we're really looking for? Is the tool going to do what we want it to do? Or are we just really fancied with the tool itself and we're finding a problem to have it solved? So really this roadmap here of taking us not only down the road of doing the assessment of risk, which we're all very good at, or at least that's what we were taught in our training, then applying some sort of technical solution, but your steps are not done. It really is understanding your organization, making that business case, which we'll talk about more in this short little interlude over the next 20 minutes, and then building that plan going forward. So keep all of this in mind. It's not just the tool, cool tech, it's really how you use it that is really critical. And so it's really important to think about these tools as opportunities to improve our safety outcomes. That's what we're really interested in at the end of the day. But we need to keep some other factors in mind. What's the value for our investment? Some of these tools cost a fair amount of money or take a fair amount of time to implement. So we want to ensure value, but yet at the same time, that's part of thinking about that, creating a culture for future change. One of the constants in our society today is change, yet how we manage that change is critically important to achieve that, as we described here, the improvements in safety outcomes. So fusing these thought processes all together is kind of important. Now, Neil talked about that security and data privacy piece, which I thought he did a fantastic job of covering down on that topic area, but it's only one of the common barriers to implementation of any technology, inclusive of heat stress technology. And so, you know, some of these other important factors, the economic one is typically the one that rises to the top. Well, it's going to cost money, but it's not just the actual money itself. It's the investment of training. It's the getting people up to speed. It's the initial outlay of funds, and then it's thinking about how we maintain those particular systems. It's thinking about how does this relate to productivity. If you're going to provide a wearable that actually impedes somebody's ability to do their job, that's an economic cost associated with that. So understanding that economic cost is really important. Leadership is also a critical aspect of any successful endeavor, and no different in terms of trying to implement new technology. And so having leadership support is critical to the success of any implementation plan. But, you know, addressing some of those leadership issues could include liability concerns. The hesitation for leadership can be cost, but it also can be the lack of leadership support that's shown towards the frontline workers themselves. Another common barrier is the knowledge, understanding the technology itself, but understanding how it interplays with some of the other processes that exist. And sometimes it's about knowledge of the actual tool itself. Sometimes it's the study of how it can be used, or the immaturity of the technology that is important to understand. And the last one that I'll talk about is culture. And that is critical to the success of any technological implementation, inclusive again of heat stress wearables. And it connects nicely to leadership, because leadership obviously is important to the creation of culture, but it's not solely a leadership function. It's about understanding how receptive to new technology, how difficult it is to change, how concerned workers might be with modifying their processes. It might be that there's regulations that drive activities, and so the culture's not to do any more or any less than what's required by law. And so if there's a lack of regulation, that culture might be really hard to implement something that isn't founded in some sort of requirement. And so these are some of the things to think about when it comes to implementation barriers. They are similar to, generally speaking, how we run our environmental health and safety programs in the workplace. I pulled this table from the April 2025 Safety and Health magazine, in which a survey was done of safety professionals by NSC. And what we found was that a number of the major challenges are associated with resources, with leadership, with worker engagement. They're the same in culture. They're the same kind of barriers that are about implementing technology. And so there is a nice connection here between your ability to implement new technology into the workplace and also your ability to have an effective program. And so, sort of they dovetail together in terms of addressing particular issues. And if you're able to crack the nut on implementing new technologies, it's an opportunity to improve your program. So let me talk a little bit about thoughts on how to counteract the economic, or each of the barriers, and I'll start with economic. As I mentioned before, it's about having a problem and using a tool to be able to solve that problem, rather than having a cool tool and looking and searching for problems to be able to address. So when it's heat stress, it's about actually identifying where are the challenges that your organization has with respect to heat stress, being able to define them well enough to identify how wearables are going to be part of that particular solution. And use that in mind with a financial or a return on investment. How's this going to improve productivity? How is this going to increase our profitability? How is this going to maybe save ability from retraining or rehiring individuals? Those are all ways to describe return on investment. It's really important to be able to align this particular solution with your business strategy. Can you articulate where this is one of the goals and objectives from the larger organization, as opposed to a pet project that you might have? And thinking also about demonstrating sort of effectiveness might be to start small and to maybe choose a few individuals to demonstrate success, or have a pilot effort. This could be a similar type of scenario that enables you to essentially be able to describe where there's success, and in turn be able to now have better economic support from others for implementing this new effort. I mentioned leadership as one of the barriers that exists. I think that the basic way to counteract this is to develop trust with leadership. And certainly all of us have a boss, and likely you have that person has a boss too. And so when you understand priorities of your boss and your boss's boss, hopefully you can work in an appropriate environment where you develop trust with leadership and understand where they think technology or technological solutions can be included in their leadership portfolio. I've been part of projects in which, leadership is not interested in newfangled technology or not interested in innovating. That's probably not the group for you to be able to try some wild, large project. But maybe there are small projects that you can try where you help to engage leadership and to see where technological solutions such as wearables can solve problems and get support from them by building trust. Again, relate your solution when you're talking to leadership about that overall business objectives. Align your vision of how the technology is going to work with the vision of the company. And then when you actually have that leadership support, use that leadership support, not just to demonstrate to yourself or to your program, but really to others in the organization, such as your frontline workers or human resources or contracting, to see where they need to now be supportive of this particular technological endeavor as well. Now, from a knowledge front, it's critical to understand the technology itself. So, you obviously need to understand where this technology fits into the solution set, but it's not just you that really needs to have that knowledge. You need to understand where that team needs to see all the aspects of this technology that can help improve outcomes. Again, back to business objectives. Know those initial and recurring costs. Know the likely, whether or not that particular wearable is going to survive working in that environment for what you think is an adequate amount of time. Know what it's going to cost to train your employees so that way, again, you can include that in your knowledge or understanding of what the total cost is going to be. And then from a knowledge standpoint, take these exercises as an opportunity to learn. Learn both from success, but also from where you might have some failures. And this is where starting small might be good, because then your failures are not catastrophic to any future opportunity. But also try to parlay any of the successes and failures of others. And I think that's where it's great to be connected with other safety professionals, see where they've employed a technology, but recognize that just because they were successful doesn't mean that you will ultimately be successful. There's other factors you need to consider. And the last one, maybe probably the most important one, really is that cultural piece. How do you create a culture that really embraces change, that understands where technology fits into the overall business vision of the company? But it really is also about developing open lines of communication. When frontline workers try on this new technology and they're wearing it, how does it actually impede their ability to do their work? Where might you make some minor adjustments so that way you achieve the vision that you collectively were trying to achieve? And when you find that success, start to share that success with others. So if you can build on it and turn it into more opportunities for change going forward. And if this really is about systems thinking, that thought process about continuous improvement, looking at how things work together, and really resist the temptation to blame others for the successes or failures that may be occurring. It's really the system that you've all set up that really needs to be looked at when it comes to implementation. Okay, so setting the stage for success. It's knowing your workers. What is their stance on trust and leadership? If there's little trust with leadership or little trust with the safety professional, then you're probably going to have a hard time of implementing technology. So that needs to be worked on in advance. What has been their implementation of technology or their change posture, if you will, experience? If there has been technology that's been rolled out and it's been done in a haphazard manner, very little training, has had terrible outcomes, you're going to struggle with the ability to implement these technologies. You have to think about that in advance. And this, again, is where starting small will be really important. We talked about culture. What's the demographics of the people on your front lines? Again, are they technophiles? They love technology and they're willing to try the latest and greatest. They love wearing wearables. You see that kind of as a discussion on the front lines. Or maybe it's just a small pocket of people that really are interested in the latest and greatest. That might be your test group that you could capitalize on and enable those small wins to turn into organizational change. And then involve workers. I mean, I think that this is a tried and true, I guess you could say, effort is, really bringing the frontline worker perspective into any change and have them understand why change is necessary. What are the opportunities for modifying the potential plans of implementing technology? And then, from a leadership as well as safety professional standpoint, when talking with workers, provide assurance, listen to some of their guidance, but make sure that your actions match your words. I think that the building of trust is really related to that. And when you find that there's a mismatch going on, or there was essentially statements made that then aren't followed through on, you'll quickly lose interest and trust from the workers. And then I think it's critical to demonstrate success in some form or fashion. And this helps really communicate why and what we're trying to accomplish. If you're able to demonstrate that particular success, perhaps through pilot tests, perhaps through some other mechanism of demonstration that this can work, you can use and parlay those easy wins to capitalize on momentum to be able to roll out that technology farther to those perhaps who are a little bit more resistant, maybe have some barriers internally to be able to accept this change. And in turn, that's really going to hopefully achieve what you're looking for overall. And then engage your workforce, maintain that open lines of communication, provide systems-oriented feedback. In other words, how do you have communications across the various interconnected portions of your organization? And for each organization, it might be different. It might be some sort of Teams chat. It might be a weekly meeting. It might be some sort of newsletter that is put out. And, you really need to fight for feedback about what the best place is to put this kind of information. So that way, again, there's feedback being shared and then hopefully being acted on. That helps to, and essentially enable more feedback to come in and from the frontline workers, because that's, again, where you're going to see either success or failure. Now, one thing to consider that from a technology standpoint, I think is a nice way to think about technology in general, but you have to do it in the right way. And it's a presentation by Chris Stormfield for the Work to Zero team from Whistle. He's from Whistle Rewards, but really talked about how you can consider recognition as being ways to improve safety programs. And to me, gamification might be a way to do this. I know I'm motivated for fitness or for learning a new language through some sort of gamification that exists, like from my Apple Watch or from the Duolingo app. The same can be true for these safety programs, but you have to be careful again about what are the outcomes you're really trying to achieve. I'd say it starts with making sure that you're sharing the data. Again, if you're driving towards reduction in, let's say, heat-related illnesses, or you're driving towards maybe some improvements in productivity, where's the data going? How's that data being used that actually demonstrates that we're achieving as a team what we're looking for? When you're not receiving any feedback and and I think of this as an individual, when there's no feedback from the data that's being collected, then there's a need to fill a gap of where that data is going. And so workers need to be able to see this data turn into something that obviously makes improvement to work processes. And then again, celebrate success. I think it's incredibly important to recognize that when you achieve success, stopping and identifying where there was success, communicating what went well and maybe even what could be improved is important to ensure that these technologies, not only in this particular case, but in a future case, can be successfully implemented. And then I mentioned systems thinking before, but I think it's that mindset of systems thinking to see the interconnectedness of these complex systems, and being curious about how they work, finding root causes when things don't go right. This is that don't blame the individual, actually find where the flaw might be in the system and addressing that particular flaw. Being open-minded to how there is connections between the group and not, thinking, well, last time this particular group failed and it seems like we're failing again, and it must be because that particular group failed that we all failed. That's not really open-minded thinking. It's really believing that we're going to set up a system, we're going to hopefully see if it works. Where it doesn't work, we'll make some changes. Where it does work, we'll keep running that the same way. And then being a good listener and observer, and recognizing that the power comes from the whole, not necessarily from individuals. And again, this rounds us back to that safety innovation journey. It's not the technology itself that's going to solve the problems. It's recognizing the barriers and opportunities that exist in the workplace, motivating your workforce, ensuring that your leadership understands what we're driving towards in terms of vision, and then making sure that you follow a plan, identify where there's opportunities to make improvements, and then hopefully find success that can build on success going forward. And so with that, we'll take questions from the audience.
Excellent. Thank you so much, Jay, for sharing that. Lots of really, really great information. Neil, I'll ask you to also come back onto camera and we will address a couple of these questions. We have quite a few here. The first is, I'm a safety professional in the utility industry. My union workforce is resistant to wearing any health monitoring device because of privacy issues. They don't like their supervisor knowing their personal health data, which may reveal a health condition they want to keep private. How are companies handling this?
I briefly mentioned unions before. This is definitely one of those issues with unions. If the union agrees with you, and if they have health and safety professionals, they may agree with you, they can usually help you get past it. But I would put the part of this back to what data are you collecting, and is there really a purpose for it? Or are you collecting enough data that shows other things? But regardless of that, even collecting the data you need, you can find things out about people. I often advocate, even if HIPAA doesn't apply, and as I said, HIPAA rarely applies to EHS professionals, but I advocate that it should be your standard. It should be a standard of care. Even if it's not the legal standard, it should be your standard of care to protect this information. I think a lot of this comes from employees thinking that information will be misused. And unfortunately, in many cases, it takes the company not doing that for the word to get out that look, they won't do that. But I mean, look, the fact is, if you learn that this person really won't be safe in this environment, I don't think as a company you can take that risk of saying like, wow, we shouldn't know this about them, therefore we won't take any action on it. But I do think at some point you also need to think about how this could fit into like a discrimination claim and the like, unfortunately, this becomes a very complicated subject, because learning things that you're not supposed to learn or in ways you shouldn't have learned it, you sort of can't ignore it, but you also have to understand what you can use and what you can't use, and whether you're opening yourself up to a suit for using it that way. So I think it's sort of the intermingling of EHS and HR. But I think that's a discussion to have really with HR to say, what if we see this? What can we do with that? And be very clear what things will and won't be used for. I still don't know if that'll get you past the union. I've worked with unions now for 16 years, 17 years. I'm very realistic in the fact that may still not get you past the union workforce. It just may not. I found the best thing for us has always been getting the union buy-in. When the union buys in, suddenly their workers are on board, or they're much more on board, or they won't get support from their union when they fight back.
Thank you, Neil. Jay?
Yeah, I just quickly want to add, that really it's about shared goals. How do you create that shared goals mentality and build trust? And, as Neil noted, when, that trust is breached, then it's hard to go back. And so it's just critical to not only say you're going to protect that information, but actually do it. And when you do it, then again, those small wins could turn into larger victories. But I just think there's so much power in this data that I think it's incumbent upon us to figure out how to do this, but more importantly, to be able to do it securely so that workers do have trust. Because when they fail to have trust, there's just so much downstream from a safety and health perspective that we lose that I think is critical to effective businesses overall.
Absolutely. And Jay, follow-up question for that. How is success defined in a program like this? I know you mentioned having access to that data is fantastic. So what other benefits can you think of?
Yeah, well, I think success is really, what are the goals you're trying to achieve? So start out from again, what is your problem? Define what the potential solutions are, define what, and then when you choose a solution, what do you define as success? And, to me, again, it might be that you need to stepwise say, well, we're going to do a pilot test. We're going to find that it's going to either work or not work. And then from there, if when it works, you're going to roll it out to the rest of the organization. That doesn't always happen because of, costs or other barriers that exist. But again, success is really in the eye of the beholder. It could be that you just get it to, 5 workers to wear it for 4 months as success, because we actually changed the culture that said, now we went from, no workers wanting to wear technology, and now we have people demanding the wearable in that organization. That could be success in and of itself. But obviously, it'd be great to have reduced safety outcomes. It'd be great to have improved productivity. It'd be great to show financial, improvements in profitability. Those are other measures of success.
I'm on mute. Thank you, Jay. Neil, I have a follow-up question for you regarding HIPAA. So it looks like there is a lot of these questions are around trying to define what constitutes a healthcare service. So one example here is around sweat and hydration. So with sweat being a biomarker and it requires interpretation of skin temperature, fluid deficiency, and sodium deficiency. Does HIPAA only trigger after a medical diagnosis and intervention by a medical professional?
So it's not the medical diagnosis side, it is the healthcare professional side. So the way HIPAA defines it, and like I said, my HIPAA discussion here was about 1 to 1.5 minutes, so very short. And I do much longer discussions on this, but HIPAA is typically triggered by medical providers with electronically transmit protected health information for purposes of things like billing and other things. And that's really like, there's a lot of technical terminology in how HIPAA is triggered, but typically the best way of thinking about it is it's a healthcare professional. So, if you have nurses on site, doctors on site, you have your own clinic that are providing medical services and then maintaining records of that, and potentially billing insurance companies for it, then certainly HIPAA is going to apply. But for purposes of the EHS type monitoring, if you're using it for the sense of hydration levels and giving hydration, you're not a healthcare provider, you're not trying to do healthcare diagnosis, HIPAA is not directly going to apply. Now, if you think someone needs medical attention and you take all that data and you then electronically transmit it to their doctor, the doctor has triggered HIPAA and your transmission of it may become part of that. It goes back to what I said before. HIPAA probably in almost every scenario, likely, unless you have a medical team, most likely does not apply to you. However, it's a great standard of care. It's not a hard thing to comply with. It talks about protecting individually identifiable information and securing it. That's not a bad thing. If you talk to your HR, they'll probably already tell you that they do that for lots of other information that they know about people. This medical information should probably be right in there. And I think that's a lot of like compliance with this. But yes, if you're going to take that information, electronically transmit it to doctors for purposes of treatment, expect that HIPAA probably got triggered by the use of that doctor, and that data now has become HIPAA protectable. But if you're leaving data that's individually identifiable out and exposed and available on the company server, or has people's, that's a problem. I will tell you, even if HIPAA doesn't apply, it's not a good look. It's just not. Because HIPAA is not the only thing out there, right? We can also look at other stuff, like intentional infliction of emotional distress and, invasion of privacy, private actions that people could allege if you're sharing their private information, potentially making them unemployable.
Absolutely, absolutely. Jay, Neil, thank you both so much. I see we are just at time. This was a really fantastic discussion. I see some of these questions are related to wearables themselves, how the devices themselves work. Definitely recommend checking out that first webinar. I did pop that link into the chat, or it's available on our YouTube channel at National Safety Council. Additionally, if you'd like to learn more about how vital signs monitors are used for heat stress mitigation, we do have a white paper available on our website, nsc.org/work-to-zero. You can check it out there. And also encourage everyone to register for our third webinar in the series. Again, that is going to be on July 29th at 1 to 2 p.m. Eastern, where we will continue talking about wearables, overcoming some of these barriers and some of the benefits. Thank you all so much for joining us. Jay, Neil, thank you again for all of the great insights. Thank you, everybody, and I hope you have a fantastic rest of your day.
Thank you.
Thank you.